This video is about one of the important question in post-graduation in clinical research, the clinical trial industry. Quite often students ask me this question, so what is the future after doing post-graduation in clinical research? And the question comes in mind because there is a lot of insecurity even after doing post-graduation in clinical research, just because of the fact that a lot of students undergo this particular course and then at least 30% people are jobless. Why this is happening? So I am Dr. Vijaykumar Gawali from BhaktiVedanta Hospital and Research Institute, Mira Road, Thane. I am into this clinical trial industry since last 16 years, and the reason which I believe is that the understanding, the practical understanding about clinical research. So what our students are doing is that they are learning this particular great science which deals with human beings directly from the organizations which are only teaching theory. So this is not a program of 11th, 12th or BSc where you just mug a few topics and then you score. This is a professional field. So you need to undergo a course which parallelly teaches you theory and the live international drug trials. You should yourself conduct international drug trials. So this kind of opportunity is given in the hospital settings. So BhaktiVedanta Hospital is also BhaktiVedanta Hospital Research Center is also offering such a system of 1 year post-graduation in clinical research. So here the first 2 months you will be taught about various 8 modules which are required to learn in the post-graduation. The next 2 months is about, we will permit you to be part of the clinical research or the international drug trials which are conducted at BhaktiVedanta Hospital. And the next 8 months, we will permit you to independently conduct these clinical drug trials. So when you would be actively conducting international drug trials, then you would actually understand what exactly the clinical research is all about. How to deal with patients, how to select patients for a particular disease for which the medications are getting experimented or the trials are happening. Then how to deal with various regulatory requirements which are by the central government, which are by the local regulatory authorities, technically called ethics committees, and how to face audits, monitorings. So if you are doing yourself, then you will be really equipped with all the required knowledge, and that's how then there won't be any question of getting the job. Because at the centers where the clinical research is taught along with the internship parallelly, what happens is when you are doing the clinical research, even the pharma company monitors, auditors, they will come down every 15 days, every 1 month to audit your work. So that's how we will start interacting with them also. So this is a wonderful program where it's a blend of the theory and the practicals. So you are in the hospital setting, you are dealing with the patients, you are dealing with the doctors, you are also visiting the pharma company representatives, you are responding to the government authorities. So you can understand you are getting exposure to whatever required or to equip you to be a great clinical research professional. And then it's just a very passionate field. Every year there is a new medications. You have seen the COVID-19, there was such a havoc, but the vaccines were experimented, clinical trials were there. That's what has saved us. So now we understand the importance of the clinical trial industry in our society. But to be a clinical research professional is very important for students to understand that the role of internship is paramount importance. So there is now awareness that after BSc, MSc, BPharm, MPharm, medical, paramedical, this is a great opportunity in post-graduation clinical research. The issue is where to do. So what we do is Google out, and then there are hundreds of organizations, because the clinical trial industry needs a lot of students every year, and they can be only from this sector, BSc, MSc, BPharm, MPharm, and the medical paramedicals. So you need to understand this, that the clinical trial research course must be done from the organization which is allowing you to giving the practice of conducting international drug trials also, and not that you complete some theory first and then you go somewhere in the internship. That's very difficult. So nowadays I see that in the COVID-19, a lot of 11th, 12th students, the BSc, MSc students, they could not attend the colleges where everything was online. So they tell me that we did not understand anything in the BSc because we were just reading the books at home. So if that is the situation for 12th and BSc, but to speak of a professional course like post-graduation in clinical research, where you are actually dealing with the patient lives. So you really need to make a judicious choice here. Thank you.